Hi. So this is Sierra. Hi, everybody. This is Sierra. And today I'm going to be talking about caregivers and the role of caregivers in the eye of somebody that has a caregiver. Now, my mother, she's going to join me on another video and we'll kind of get into more of her role as a caregiver. In this video, I'm just offering some advice on what caregivers can do to better assist their loved ones living with an illness. Of course, I have MS. I've been living with MS since April 2016 when I was diagnosed with it. And it has been a ride. And I have had the opportunity to learn over the years what works for me as somebody who's receiving care and what works for the caregiver. So the first thing that I think is important is the caregiver to understand what their loved one needs, or whoever they're taking care of, what they need. So checking in with them health wise. If the loved one is noticing something is a little off with them, maybe the loved one is experiencing more symptoms than usual, or the loved one is experiencing, like I can say, for example, for MS, with me, when I start experiencing more spasms in my legs, in my arms, I start getting more headaches. I start feeling more fatigue. I have series of vertigo. My mother, she'll notice that, and I will communicate that with her. I will communicate that to her, like, hey, I'm not feeling too good right now, or I'm just having a moment, or I'm having a little episode. So it's good to not only recognize the verbal clues, but recognize the nonverbal clues that the person you're taking care of has. Some people are not as verbal, and or they may not have the ability to speak, but if you will kind of know, if you're around them and kind of get to know how they are in their state when they have good days and when they have bad days, you can pretty much tell. If I'm really having an episode, my mother, she'll be like, okay, Sierra, you just need to relax, get on the bed. And she might, rub my arm or something like that. If my hands are, because I've had moments where my hands have literally looked like claws. So they've been really like stuck. And just moments where I just couldn't move because I was having a lot of plasticity going on. And so she knows, like, okay. And I tell them, like, Mom, I can't move. I'm having a situation here. So she'll, lay me down, sofa, bed, wherever we're at, or might be in the car. And she said, okay, you need to relax. And she'll get me something to drink. And I'll just make sure that I am in a state of just being calm. And she'll give me my baclofen. She'll check my blood pressure if they're really severe. She'll check my blood pressure. She'll check my oxygen levels. And she's like, okay, it's time for a baclofen. So that's like a muscle relaxer. And they help out a lot. I just take one, it's 10 milligrams. And I just relax. She may give me some lavender on my pillow or something like that she'll do for me. But I think it's very important for the caregiver to understand, to know their loved one's symptoms of when something is not normal. What is your loved one's normalcy? What is normal behavior? Because everybody has different MS symptoms, but what is kind of out of the ordinary? And it could be possible signs of your loved one possibly going through a relapse, or just having a really bad day or a really bad moment. So that all needs to be accounted for, and just making sure that you keep in contact with your loved one's healthcare team, and you have a relationship with the neurologist nurse, and your neurologist and your primary care, all of them. Make sure you have a good talking relationship with them. So if that loved one did need something, or you needed some advice, or they need to be seen, then they will know who you are. They need to know your name. They need to know your situation. And it really matters when you communicate with the primary doctor, with the neurologist, well, in this case, with the neurologist, to let him or her know, look, this is going on with me. I'm not too sure how I'm feeling. I just don't feel too well. So they will know how to further assist your loved one. Fortunately, there are times where patients slide through the cracks. And it's not because sometimes people don't care. It's just like, look, people are busy. But guess what? I know you're busy, but you're going to know my name. And you'll know my caregiver's name and my other family member's name. We're gonna do this respectfully. We're gonna do this peacefully, but you're gonna know my name. And sometimes it may be times where you have to be a little bit firm so you can get the things that you need, as far as, advocating for your loved one to get the medicine, to get a test done, because everything is through science, okay? And sometimes, with MS, if it's not explained through a lab test or MRI as far as your symptoms, then the neurologists, they don't work off of that, okay? They work off of science. They work off of what they can see and what can be resulted. So a lot of times you do have to just be there for your loved one, be an advocate for them, validate their feelings, validate their symptoms, like, okay, I know this is going on, and just check in with them. Just be in tune with your loved one's body. So if you know that they've been getting more muscle spasms lately, if they've been getting more headaches, if they've had changes in their bladder, if it seems like they're getting more weakness in their arms and their legs, kind of check on that. It may be a thing with the treatment. The treatment may have to change or be adjusted, or maybe a thing where they might be going the early stages of a relapse. You don't know. MS is very unpredictable. And you just have to take it day by day, because the changes are constant. Being aware of the things that your loved one is going to need. They're going to need medication. So making sure that you keep that you're pretty aware of when they got the medication refilled, when they're going to need to get the medication refilled again, how much they have. How do you do the medication? Do you keep it in a bottle? Do you mark it off, as you go with a calendar? For me, I have a medication box that just keeps my medicines in it. Now, my treatment has changed again for MS, but I used to take two MS pills in the morning and 2 MS pills in the evening. But now my MS pills have changed, so I just take 1 pill. But I still keep this, though, because it's pretty large. Do you have a medication box like this? If your loved one has an issue with incontinence, do they have the adult diapers? Do you have change of pads? Do you have wipes? What about medication? Safety, safety, safety. If your loved one has some mobility issues, and it poses a safety concern, then definitely invest. Talk to the neurologist about ordering some medical equipment. It could be a cane, a wheelchair. If there are fall risks, just be careful around, the things that you have around the house. If you have shoes around the house, if you have pets around the house, if anything that's going to cause them to trips, wires, anything like that, you have to be really careful. I know myself, I have tripped over shoes. My dogs wanting to play with me, I have tripped over my dogs. And I just have to be extremely careful, because I do not want to hit my head. And I do have issues with my mobility. Not as often as I did, because my MS is stable now. But I do have those times, even when my MS is stable. So making sure that you safety proof your home, Just have it be safety proof enough so the hallways are clear, nothing is in the way to pose a threat, or a tripping hazardous. So make sure the hallway, the bedroom to the bathroom hallway is pretty clear, or to the kitchen, or to wherever else they need to go. Also will help if they had walker or a cane, they can get to where they need to get to safely. And be mindful that your loved one is going to go through some changes. I know for me, my mother, she knows me. She knows the times that I'm kind of feeling, because there are times I feel a little down because I'm trying to figure things out as far as my life, my body, and sometimes not really understanding what's going on. Just recognize that loneliness. Recognize when they need support, when maybe they may need to just get out of the house and go somewhere, go to a store, go get some ice cream. It just depends on the severity of it. Or just go outside, in the wheelchair, get some fresh air, or, go to the park, go to a community center, and just go outside and just breathe the fresh air. I love outside. With that can come some anxiety and depression. And like I said, it depends on the individual. Not everybody is going to have the same symptoms. Not everybody is going to feel sad or uneasy about it. Some people just go into it, and then some people have a little bit more difficult time dealing with it. The progressive stage, from the people that I have met with it, I've met some people who've just been down in the dumps, but other people, they're very much like, you know what, I'm going to be in this wheelchair, but I'm okay. I would say just recognize the signs of when your loved one is feeling lonely. They have the depression, the anxiety. If they're being withdrawn, I was very withdrawn. I did not do a lot of talking. I just did a lot of things internally, and just felt sorry for myself, laying up in the bed, not really doing all what I needed to do for myself. I'm just being transparent. I don't really care about anything as far as being transparent. My mother recognized that, and she said, you need to get up from this bed. You need to get yourself together. You need to stop being in a slump. We're going to get out. We're going to go somewhere. You're going to work on this. You're going to do that. And she really encouraged me that I may not have control over that, but there's other things that I do, and work on some stuff or do some stuff that makes you, and this is a side note, I think this is a tip that you can do if your loved one is struggling with the anxiety, depression, the withdrawal, the social isolation. Try to get them involved in groups, organizations, support groups. Try to get them involved in some of the things that they liked to do before they got sick, because normalcy is very big when you have MS, because your body's already going through changes. But if you like to color before, continue to color now. If your hands or your mobility, your fine motor skills are affected, then you may have to do something different, and that's okay. You have to adjust to change with MS, because you just don't know, because those nerve impulses is just the nerves going everywhere. You don't know when you're going to get a spasm, and you don't know when your body's going to go numb, or it's just like you don't know. But I feel like normalizing and making somebody feel like, hey, you can still do this, or hey, have you tried doing this? Making them feel like they're a person again. Because if they are taking the treatment and they've dealt with a lot of social withdrawal and they're embarrassed, or just a lot of things, it can make them almost feel like a robot, like they're just going through the motions. But if you was to say, hey, you know what, you still like doing that, find something that you like to do, encourage them, push them. And you may have to show them tough love. I know my mother, it got to a point she had to show me tough love, and I had to further propel the things that I needed to do to push me as a person and to push me into starting a business. And I'm so glad that I did it. Now with the support groups, I know me personally, I looked at the National MS Society. They have a link that says join a local support group. Now right now during the pandemic, they have a lot of groups that are through the internet. And so that will probably have to be an adjustment. I don't know when they're going to do it back face to face again. Once this pandemic is over with and people have gotten their shots and people have gotten, vaccinated, and this virus is down to a level that is controlled, then I believe they'll open up the group so you'll personally have groups that you can go to. And the person may have to talk with a therapist. Because they may have to talk with a therapist. It's not easy having to deal with a chronic illness, especially, I believe, especially if it's more on the progressive side or the symptoms are a little worse. My symptoms are moderate, so my symptoms aren't severe enough to completely impair me socially, emotionally, or physically. And again, making sure that you're keeping up with the appointments and keeping up with your loved one's symptoms, keeping up with how your loved one is feeling, whether or not they need a support group. But caregivers, making sure that y'all take care of y'allselves, because y'all have a really difficult job, a task, and it can be stressful. And you all need a break. So carving out a little time of the day to just unwind and do some of the things that you like to do, okay? So you may say, hey, I like to read a little bit. Read a book for about 10, 15 minutes. Do what you have to do, drink your coffee. Or you may have to take a little walk. Make sure that person is stable enough. They're good. Make sure you take a little walk. You might have to have somebody to watch them for a little bit if you have the privilege of having somebody to watch them, because most people don't. And then just, but you could just be like, I need to take a little break. I need to get out the house. I need to go to the store. I need to kind of take some time for myself, because it is overwhelming. And one thing you don't want to do is get so overwhelmed to you are possibly taking out, anger, aggression, or frustration out on the person. I feel like there are times where people with the chronic illnesses or people with MS, they get a little frustrated and they're not the easiest to get along with. It's important for that person, that caregiver, to have that break, have that mental and emotional break, so they can kind of like refill again, refill, refresh. So it's really important to do that. And they do have support groups for caregivers. I know I went to a conference, and this was back in 2019. I enjoyed it. It was for African Americans living with MS. They had a breakout session for the caregivers. I felt like, from the feedback I got from my mother and from my sister, they really enjoyed that group, because they felt like, they weren't alone. They felt supported, and they felt like some of the issues that they were going through with their loved one, as far as coping and dealing with a loved one going through those changes, they felt supported. My mother's been able to make some connections with some people there, which has been very uplifting for her. And my mother advocated for me with one of the group leaders, just, help me get back in the swing of work and everything. And had a wonderful woman. She worked with me, and she helped me do my resume and kind of get back in the work field. And it was amazing. Some of the groups that I know about, definitely the National MS Society. Through the MS Navigator system, they have on their website, they have a place where you can join local groups. Also, resources, webinars, educational material. about all kinds of things related to MS and things for, emotional support, that you can go up there and just see what you need as a caregiver and reach out to people, because the help is there. You just have to navigate the system, okay? Learn how to navigate the system, build your network up, build your support group up within the MS Society. There is a Family Caregiver Alliance where they give out resources to caregivers, as well as tell caregivers about different programs that they're having. The Caregiver Action Network, where the caregivers can receive support and resources. And the biggest way to receive help the quickest is just asking your loved one's neurologist, what are some resources for caregivers that you know about, that patients seem to like, that they said were helpful to them? That will be a great start. That will be an awesome start. And I'm going to have another video with my mother so she can kind of explain her role of caregiving. But this is a really big topic, because anytime you're talking about somebody having a chronic illness, that not only impacts that person, that impacts the family unit. Whether that family unit is somebody, a young mother with a young child. It can be an elderly parent with a sick child. It can be a middle-aged person. It can be anything. But in regards to MS, there is pediatric MS. A lot of MS shows up in the early 20s. That's just when it shows up. So shows up later, and it may be an individual's child taking care of them. My mother is my caregiver, but it may be a situation where a child has to be their parent's caregiver. So really the dynamics of that, and cousins and grandmas and grandpas, it's a big family. And I can say this, the MS Society just has a lot of information out here, a lot of support. Lock into a local group to just further help you with that phase of your life. They have many different doctors, neurologists, whatever works for you. Lock into that healthcare team, lock into that support group, lock into that support network, because it's out here. And I'm going to leave in the link some helpful things that have kind of helped me in my MS journey, and what has helped my mother as well. But I'm going to have her up here next time talking about me, talking about how it's been with her taking care of me, and what MS Resources has helped her. This is Sierra. I want you to live your best life. I really do. Like, comment, and subscribe. What are some of the resources that has helped you and your family? Caregivers, people who have MS, tell me. Let's share. Let's be a part of us all healing together and us growing together. This is Sierra. I want you to live your best life, and I'm signing off. Bye-bye.